Good morning. My name is Dr. Shivam Om Mittal, and I'm a movement disorder fellow neurologist at Mayo Clinic, Rochester, Minnesota. I'm honored and thankful to Mayo Clinic to give me this wonderful opportunity to talk about our study. The title of our study is Botulinum Toxin in Parkinson's Disease Tremor, a randomized, double-blind, placebo-controlled study with a customized injection approach. This will appear in an upcoming issue of Mayo Clinic Proceedings journal. Parkinson's disease is a common neurodegenerative disorder with an estimated prevalence of 2% in the elderly population. Tremor is the most common presenting symptom at the time of diagnosis, which is a rhythmic, oscillatory, involuntary movements of the upper limb. The tremor in Parkinson's disease significantly impacts the several domains and domains of quality of life, from physical to psychosocial. Tremor may be disabling and socially embarrassing. Unlike other cardinal features of Parkinson's disease, such as bradykinesia and rigidity, tremor is sometimes refractory to levodopa therapy. A need exists for a treatment modality for refractory Parkinson's disease tremor with safe side effect profile, especially in the elderly who are sensitive to the systemic side effects of medications and are not keen to have a surgery. Botulinum neurotoxins have been used extensively for treatment of dystonias and also in post-stroke spasticity. To this date, there is no randomized controlled study performed to evaluate the safety and efficacy of botulinum neurotoxin in Parkinson's disease tremor. This study was performed at Yale University, New Haven, Connecticut, on 30 Parkinson's disease patients with refractory hand tremor. It is a double-blind, placebo-controlled crossover trial injecting botulinum neurotoxin into 7 to 12 hand muscles. We have used a customized approach to inject the hand muscles. Patient's hand tremor was clinically evaluated and muscles causing the tremor was identified. The tremor activity in these muscles was confirmed by rhythmic burst potential by electromyography, EMG. The dose of botulinum neurotoxin was quantified based on the tremor activity on the EMG and the size of the muscle. The number of injections in each patient ranged from 7 to 12, with an average of 9 injections per patient. The total dose of botulinum neurotoxin was on average 100 units each patient. In the placebo group, the same techniques were utilized to identify the active muscles. The subjects were followed for 24 weeks. The treatment efficacy was evaluated by the tremor subsets of Unified Parkinson's Disease Rating Score, UPDRS, and the Patient Global Impression of Change, PGIC, at 4 and 8 weeks after each injection. Hand strength was assessed by an ergometer. The novel injection pattern of botulinum neurotoxin for tremor in Parkinson's disease patients improved the tremor on the clinical rating scale and also, most importantly, patients' perception of improvement, with no evidence of statistical significant hand weakness. Now, what does this finding mean for patients? The results are promising and adds a new tool to the physician's armamentarium for treating hand tremor in Parkinson's disease patients. In future, larger studies using a further refinement of a customized technique implemented in a larger patient population would be crucial. Thank you. I hope you enjoy reading the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.